Hey guys, Don here. Welcome to Podiatry Practice Mastery. I'm going to go over the $1 Million Minute. This is a recording of a Wednesday in the clinic. So Wednesday is when I'm in my Westboro office, which is kind of a newer office. Thankfully, it's been kind of getting busier. I know there were some times where it was a little bit slower. Not sure if it's because it's the time of the year. Today I had a doctor visiting me. He's an anesthesiologist. His name is Dr. Stu Schneiderman from Rhode Island. And he came because he was thinking about collaborating with a podiatrist. So there's a podiatrist in, actually, I think it's New Hampshire, not Rhode Island, New Hampshire, that he offered to do some PRP injections for the plantar fascia, and then he came in to learn diagnostic ultrasound. So he came and spent some time. He was familiar with fluoroscopy, but he wasn't as familiar with the diagnostic ultrasound. So I was showing him on my patients, both plantar fascial patients and Achilles, because those are the two most common things that he'll be doing, how to do the ultrasound, how to like label it and things like that, what to look at for pathology. So I was showing some pathologic plantar fascias and pathologic Achilles tendon. So it was nice to have him. I thought it was a neat idea. As I was talking to him, currently for Regenerative, we're doing mostly Shockwave. There is a place, I think, Synergistic, and I liked one of his sayings. What he said is kind of the same way taking Tylenol and Advil together can be synergistic, using Shockwave and PRP or amnio can also be synergistic, kind of making them work better together. That was one of the sayings. Every time I get with another doctor, I like to kind of hear what their wording is. So I think using that as an explanation can help us. The other thing that he said, I just think it's interesting, is as doing inner pain management, he was noticing that most of the back surgeries, 30% maybe got better, 30% stayed about the same, and 30% were worse. So he has these little kind of phrases that he used. Another thing that was really nice about Stu is that he had a great way with patients, meaning something that I feel like I could learn from him. He asked patients about themselves when he saw type of surgery that they had before, when they the shirt, what was written on the shirt, a little bit about their lives. So he was genuinely interested in the patient, and I think this is something that if you've ever read a book, if you haven't read this one, this is a good one, How to Win Friends and Influence People. I feel like he was just genuinely interested in others and learning about them, which I think is a nice thing. I think many times I get busy just going, and not actually spending the time showing interest in others. We might talk, but I'm not always showing the interest, so that's something I feel like I could take away. Okay, let's go into the day here. First patient of the day was a 49-year-old that came back. She had had 2 applications of Onifix. I usually do them 3 minutes apart for her ingrown toenails. They're growing out nicely. I didn't have to do another Onifix. I'm going to let them stay on until they fall off. She was mostly here because she had a painful callus on the second med head, like an IPK, so I did lesion destruction. Might be a possible wart, I'm not sure. Next patient was, this is number 6 of 6. This is a gentleman on the right side. He had a spur removal and a reattachment of his Achilles by ortho, and he was never better the whole year and a half. Since then, no better. They said everything looked fine in the surgery, but he still wasn't feeling better. So he's 6 of 6 Shockwave with an amnio, doing quite a bit better now. I think he's going to continue to get better. So today was the last visit. So usually on last Shockwave visits, I do an office visit, level 3 visit, because I'm kind of planning what the next things are, and he's going to do a 6-week follow-up. Next patient was a 65-year-old female. She had kind of a badly, not really comminuted, but kind of displaced fracture of her 5th metatarsal, and she was doing this as Shockwave 3 of 3 on that area. And I was talking to someone recently at that conference, and you can't really say that Shockwave makes the fracture heal faster. I think it heals maybe 20% faster, but what the research shows is the return to play, or the return to activity for patients, is about 50% faster. And it could be because the bone's healing faster. It could be because she has no soft tissue swelling despite such a bad fracture on her 5th metatarsal shaft. She is going to be seen back in 3 weeks. I got an X-ray today. She's going to be seen back in another 3 weeks. Next patient was a 39-year-old as well. She had a porokeratoma, or IPK. I did lesion destruction as well, just to talk about not having it come back. We talked about doing orthotics, so she did orthotics, so that was orthotics 1. Another patient that came in today, 55-year-old, she's one of my post-ops for a bunion repair as well as a fifth digit arthroplasty. So I did x-rays. Everything looked fine. She had a little bit of red around the incision, so I gave her an antibiotic. And she does have a little bit of chronic pain issues, so she's having a little bit more pain than others, so I had to give her some more pain medication. But she is doing well. She said she's in quite a bit of pain. Could be from the nerve issues that are going along with that. But this is one I always like to kind of share the good, bad, and the ugly. Like this is one of the surgeries that kind of kept me up at night. You just kind of question yourself. Everything's going to go okay. She's actually there was a nail tech that visited me, and she learned about how to do nails, wasn't doing her own nails, and then she went in to go to be a PA, or actually was a nurse practitioner, and this is her mom. So I lose a little sleep over these ones because I'm concerned how they'll do. Keeps sometimes wake up in the middle of the night. Is everything going to be okay? She seems to be doing fine. I'm going to see her back next in about a week to take out her sutures. Next patient was number 4 of 6. This is a patient that was having pain and swelling of the posterior tibial tendon. We've talked about that. He's going on a long pilgrimage where he has to walk 500 miles over a number of days. And he's going to do about 10 miles a day for this pilgrimage. So he wanted to get better for that. He is doing better with his posterior tibial. He has quite a bit of bilateral edema as well, so I asked him to talk to his doctor about possibly getting a diuretic, because I think some of that could be coming from some of the swelling. Next was a matrixectomy on the right for a patient. No follow-up for that. And then another patient was Shockwave number 6 of 6 for plantar fascia. I'm going to see her back in 6 weeks. So she's doing much better. Next patient was this is a patient, kind of a complex patient that I see a number of times. He came in for a nail sample. He was recently admitted to the hospital for pneumonia, so he's not in a good place. He was concerned about foot pain, but I think the foot pain, and I've realized this more and more, either patients that work at home or in the hospital and they're on these socks all the time, many people can develop like calluses on their foot or other types of foot pain because they're not in supportive shoes. They're not in any shoes. And more as people are at home working barefoot all day, or at like the hospital, this guy, I think some of the foot pain comes from that. Next patient was a patient that came in for a nail fungus follow-up. There was no fungus. She had some calluses that I trimmed on her. Next was a heel pain patient, number 2 of 6 for Shockwave. Next was a Achilles patient, number 3 of 6 for Shockwave. Next was a patient, 64-year-old, that had previously had ingrown toenails on the medial hallux bilaterally, so I did matrixectomies, and no follow-up for that one. Next patient was a patient a 79-year-old patient that had a distal ingrown toenail. So these are toenails typically when the nail falls off, or I avulse them, and as it grows back, it digs into the front tip. And so I trimmed off some of the hard callus, and I do T-taping, which is where I use like an elastoplast tape to go across the front, like horizontally across the front of the toe, and then I tape it down so it doesn't grow in there. And then he also 5 years ago got bilateral balance braces, and he came back in because he knew in 5 years he can get a new pair. So we're going to check with his insurance, and then we're going to set up a casting appointment with my medical assistants. Next was a 44-year-old female, number 2 out of 3 for Achilles, Shockwave. I think she only wanted 3, or I think she was concerned about the price. That's why we did 3. Usually I'm doing 6 for these. Next was a patient. He had kind of a painful second MPJ, more on dorsiflexion, and no real pain on the second med head, but more on the dorsal aspect. It was hard to see it on the x-ray. And he has some kind of swelling there, almost like an AVN type of a second MPJ. So I am going to be ordering, and I couldn't see it on the AP, so I'm going to be ordering an MRI for this gentleman to see how he's doing. He asked about Shockwave. I tend to do more Shockwave on plantar second med head, not so much on dorsal second med head, because that's just what I see. So the dorsally, I'm concerned it could be a spur more so than like a capsulitis. And then the last patient of the day was number 2 of 6. This is a patient that has MS, kind of a difficult one. She really could tolerate very, very limited radial or focus shockwave. So she has a kind of really low pain tolerance or a lot of pain, one of the two. I was concerned about here. This is the one that I got an MRI of her foot to make sure that there was no tendon tear or a navicular stress fracture. Did not show any navicular stress fracture. We also got a CT, no stress fracture. And because her pain seemed to be out of proportion, and she had the MRI lit up on the medial navicular, but I think it was from the shockwave sessions that I did. So whenever you do shockwave, if you're then going to get an MRI, which you shouldn't, it's going to light up. And so this is just a learning experience with her. But her pain was so kind of severe, I had to tone everything down. So for the radial shockwave, there's a silicone tip. It's a white tip that you can use. And so I did that on it because it's much lower intensity. And then for the focused, I could barely get to 0.07 or 0.1, which is very, very low for focus shockwave. So that was the day. It was a good day with some good patients, and it was always nice to have another doctor. If you want to come and visit me in the office, I always make myself available to that. I enjoy doing that. I recorded a podcast with Stu that'll be coming out in a couple of months because I have them scheduled every Monday, those different variety podcasts. But if you want to come out, I'd like you to just let me know, reach out to me. Also, if you want help with your practice, fill out my audit. I took a lot of time to put this audit together. That'll kind of help you to kind of figure out what's going on in your practice. I think just filling out the audit itself will be kind of mind-opening to you, gaps in your practice and things like that, and help you kind of write down what you want to do in life and with your practice. So I'll put a lot of time into that. If you want to get that, you can go to podiatrypracticemastery.com/audit, fill that out, and then we can kind of meet some time. Once again, if you want to come visit me, just let me know. Okay, have a great day.